If you are a woman who is in perimenopause or menopause and you have been prescribed bioidentical hormones, specifically the estrogen patch, which is typically applied to your abdomen twice a week at whatever dose, and oral micronized progesterone, a capsule form, typically 100 milligrams or 200 milligrams, those two hormones are very commonly prescribed for women. And in some cases, they might alleviate or even resolve most of your symptoms. However, the majority of women, those two hormones do not address all of your symptoms. They're not really designed to. And specifically, what I'm referring to is things like vaginal dryness and low sex drive. So in all the years that I've been in practice, I've seen a lot of women prescribe the patch and the oral micronized progesterone. And while that can help, it leaves these other two very common symptoms unresolved. So one of the best ways that can be addressed is not so much raising the dose on the estrogen patch, but actually getting a prescription for bioidentical estrogen applied topically vaginally. And that works beautifully because there's a lot of hormone receptors, estrogen receptors, in that location of our body, understandably. And so using a vaginal topical bioidentical estrogen, whether it's estradiol and or estradiol, in combination with the estrogen patch can often address that symptom. And in some cases, you might even be able to use the topical estrogen cream instead of the patch at the right dose so that you can actually go off of the patch. I've actually done that with a lot of the clients I've worked with. The other common symptom that is often unresolved through the patch and the oral progesterone is low sex drive. One of the best hormones to address that is bioidentical testosterone in a topical cream form, also applied vaginally as well. And in the right dose, that can work amazingly well to stimulate, to ignite your sex drive. Those two hormones, topical estrogen and topical testosterone, in combination with the estrogen patch twice a week and the oral micronized progesterone at whatever dose, that combination often has the ability to address a lot of other symptoms, but specifically the vaginal moisture concern and the low sex drive.